Welcome to our series of mental health moments and conversations. We are doing these to offer different perspectives, often from caregivers, and to offer support so that those with similar experiences don't feel alone. Some examples in this series may be close to your experience, and some may offer a new perspective. We want to show unique situations while also highlighting that mental health and struggles we face have commonalities across demographics. We hope this series helps to shed some light on mental health and to help others know that you aren't alone. At times, we will bring in clinicians to offer their professional advice, but more often, this series will highlight someone with lived experience, offering their insights and with the goal to raise awareness and provide support. We appreciate you watching, and remember, you are not alone.
Hi, I'm Matt Mishkin. I'm the Deputy Director of the Johnson Depression Center. And today we're going to be talking about eating disorders, probably a little bit more specifically anorexia, because that's where my experience comes from. And I'm here with Dr. Jennifer Hagman, who is the Medical Director of the Eating Disorders Program at Children's Hospital Colorado.
Thanks, Matt. I'm really pleased to be here with you and appreciate you being willing to share your experiences. I am the medical director of the program at Children's Hospital. I'm also a professor of psychiatry here at the University of Colorado School of Medicine. So, Matt, I know you were willing to share your personal experience and from the perspective of a parent, but you're also a professional, and I know this was probably a very different kind of experience for you.
My daughter has anorexia. She still has anorexia. We're going on a couple years now. And I like to say our story was probably similar to ones that a lot of people have. We came a little bit out of COVID, so there's the COVID aspect there. But our daughter, she started eating differently, in some ways eating better, focusing on better eating, or so we thought at the time, exercising a little bit more. So over time, what we noticed is things started to go a little bit differently than what we thought initially was eating better. Smaller portions, limiting things, limiting the types of food she was eating. And then as her parents, it took us a little bit of time, not too long, maybe a month and a half or so, to really start to see noticeable weight differences. And then I remember we were on a family vacation and we were having, I believe it was salmon, and she took such a small portion. And I remember looking at her, and my wife kind of, I think, had the same thoughts. And we really then noticed the weight change. And we ended up that family vacation and immediately came back and started to look for services. We could not have predicted this. We couldn't have stopped it. We couldn't have prevented it, I don't think. Much like an oncologist can't prevent cancer in their own child, I think I've started to look at it that same way. Probably as being a professional, my wife is also, she's a psychologist. I think we sought treatment sooner than what other people might have sought, but I do want to remind people that this happens to everybody, and even though we're in the field, I don't think we could have completely prevented this from happening. So that's a little bit of our story. What do you see? When most patients or parents come to you, what brings them in, or what point are they in their journey?
Yeah, I think your experience is pretty typical, if you will. I mean, in the beginning, most parents, start to notice healthier dietary changes, and initially, a kid might get positive reinforcement for that. And then you start to notice maybe it's going a little bit too far. And parents start to wonder, could this be a problem? I'm not really sure. Kids are usually trying to hide things at that time. They are somewhat aware that what they're doing might not be okay, but they don't want to stop because they're really anxious usually about weight gain. It's not unusual to hear a vacation really being the moment where, parents might see their son or daughter in a bathing suit, or be more aware of eating habits because you're together for all the meals. So that's not unusual at all. Sometimes, though, parents and kids even are really caught off guard when they go to, say, a pediatrician visit for maybe a sports physical or routine care, and the doctor notices significant weight loss or weight fluctuations and a low heart rate and sends them to the hospital. So for some families, it starts with really the shock of a medical hospitalization. But I think your experience is really what we hear about most of the time.
The one thing that we also tried, and I think this is fairly typical, so I'd like to hear, is we tried to do it ourselves for a while. And I remember talking to her therapist who was in the eating disorders program. We initially connected with somebody, and she said, I think she's going to need the partial hospital program. And we weren't quite there yet. We tried to say, no, I think we can do this. I think we can get a therapist. We'll get a dietitian. Maybe we did that for a week, and we came back, and she very nicely said, I thought this might be the case. And so she held our spot, which was nice. So we were able to get into the program. And that's really where we learned about family-based treatment, which I know is really the gold standard, the best type of treatment. So what do you hear from parents about the family-based treatment versus trying to go it alone?
Yeah, I think most families do the same thing as you do with most problems you encounter. You try and figure it out as a family. You try to adjust your parenting a little bit. Oftentimes, by the time parents get to us, they're down to having fights at home and really unpleasant times at the dinner table. They might be sitting at the table sometimes for hours while a teen or younger child refuses to finish. They're really frustrated, really angry. Family communication has really become very challenging, and they start to realize this may be more than we can do at home or without additional help. They don't usually come in expecting family-based therapy. And it's really not that complicated. It's really an approach to care for eating disorders that brings the whole family onto the treatment team and really helps parents learn how to support and help their child with this problem. It's coaching parents, teaching parents what they need to know about the process of an eating disorder and how it's changed, how their kid is thinking and behaving. But they don't always come in expecting that much family involvement. It's really powerful. Families are the most important people in a kid's world. And watching family-based therapy really come together is really, really powerful.
It took family-based therapy for us and our kids to actually learn some of these skills. That it takes that for us to learn some of these life skills and how to even engage with each other, and the emotion coaching. That was a huge piece.
Yeah, that's a really important part of this.
And that's one thing when I talk to other parents who are going through it, I'd say, if you've never heard of emotion coaching, here's what I know about it. Go look it up, because it's beautiful, and it doesn't just work for eating disorders. It works
Right.
for so many different things.
Yeah, that's really true. It's really, really great to hear you say that. Were there other things that you found particularly helpful, supportive, or meaningful as you went through treatment?
Yeah, I think honestly, learning more about what eating disorders are, learning more about anorexia. I know that the research is still out there, but even potential changes that are happening in brain structures, why it can be so difficult to treat eating disorders. We learned a lot about that. Like I said, emotion coaching, and just, I think, to an extent, learning how to, we like to say, kind of get through the tidal waves.
Yeah.
Because there's so much emotion happening, and there are times where it is very, very difficult, and learning steps to get through it and say, okay, we've been here, we know we can get through this, and what are the coping skills that we have, and how can we actually help our daughter get through it as well. I'd say those are some of the most important things. I don't know, do you hear from other parents what they say when they leave the program, that this was the best thing for them?
Yeah, it's really a pretty short-term intervention. Our program is typically 5 to 7 weeks for most families, and as you alluded to, it's a day treatment program, so kids are sleeping at home at night. Almost every family that experiences an eating disorder in their world, and especially anorexia nervosa, when they first present for treatment or come in for treatment, they're pretty frustrated. They're scared. They may be feeling really guilty. They're feeling really responsible in some way. And over the first 2 weeks, we really spend a lot of time trying to help families let go of that and focus on kind of learning what they need to know to help their child with this problem at this point in their kind of life path. And it's pretty amazing to see that usually by the third week, parents are starting to feel a lot more confident about what they're doing, about how to help their child finish meals and manage their emotions and communicate differently. Watching that all kind of come together is really, really meaningful. And families, when they feel empowered and when they don't feel blamed, when they feel like they're truly the most important part of the treatment team, it's really impressive to watch. And kids Almost always, not always. It's not easy, but kids really, when their parents are approaching them, especially with the emotion coaching, it's so powerful, and you really watch your child sort of relax into it, or be able to cry with you, or talk more with you, or just take a deep breath and take the next step forward. So it's really that change comes around fairly quickly. You think about just a few weeks where that starts to shift.
You're right, over time, and it didn't take that long, where we started to, I think she started to come to terms with kind of what was going on. She still didn't necessarily admit that she needed to be there, but I think there was a part of her who was recognizing it. The level of conversation that then we were able to have, and now even being able to joke about certain things and kind of, call certain things out. I think it, I don't wish this is why we got to this point in our relationship, but it's definitely strengthened the relationship in some ways.
Was there anything you found particularly surprising as you have gone along this journey into a recovery?
Um, I don't say this to reduce hope for anybody, but I think just the longevity of the journey. I think, and maybe that wasn't surprising, maybe that was hope that it wouldn't be that ongoing. Like I said, we're 2 years into it now, and we're still working on it. And I suspect this is going to be something that's going to go on for a while. The amount of help that we got, and then sort of said, well, and continue to get help. So I don't want to make it sound like we don't get help, but how much of this is done at home and with the family, and how much professionals help us out, but then say, well, you all have to go and figure this out, and how is it going to work in your house, and
Yeah, you've got to take this home and then keep it going with busy life and school.
right, and how do you figure that out? And I think that comes from this idea about, I guess, wanting the hand holding all the time and feeling comfortable with it, and then just having to sort of embrace the fact, and like you said, that you go home and you finally feel, I don't know if you ever feel 100% comfortable, but you feel like, okay, we can do this, we can manage this.
Yeah, I think it's so important what you mentioned about kind of accepting that, coming to realize that this is going to be needed for a period of time. And as a parent, you've got to keep this on your radar. And for the child too, to kind of accept, this may be a process, and how long it takes is really different for almost every family. But just accepting that, I think makes you better able to kind of maintain the confidence, maintain the structure of what you need to do, still be ready to, kind of step in at a higher level if you need to, and also being able to back off and be less restrictive when that isn't needed anymore. But really coming to that realization, I think, is really important, and that's a process too.
What do you say to parents to really give them hope in this process, especially those who might just be entering it, or those who've been in it for a little bit of time? What do you say to them to give them hope in it?
Yeah, it's a good question. I've been in the field now for over 30 years, and I can truly say to parents with full confidence that the majority of folks who have this problem go on to do really well. And I've seen so many people recover, who had short duration of illness, longer duration of illness, 5, 10, even 15 years or more. You really can recover. I mean, and I think the power of FBT, and again, it's really a somewhat simple concept, is that with an early intervention, with really strong, effective, empowered, knowledgeable family support, kids do really well, and young adults do really well too. And it's really just saying, if your support system knows how to help you, knows how to be supportive when you're having a really hard time, knows how to help you tolerate high distress emotional states, that kids do really well. And I think it's also really powerful. It's why what you're doing is really powerful when you hear from someone who's been through this, is finding their way through this. And you hear that, yes, people really can get better. People are getting identified so much earlier. When I started in the field, it was an average of 3 to 5 years before people were coming in for treatment. That's a long time to suffer and be persistently ill. With earlier intervention and more effective interventions, the outcomes are looking so much more different than they were before. So Matt, I know we've talked a lot about your family's personal experience. You also are in this position with the Depression Center. How has going through this as a family impacted how you think about community education and the work you all are doing here?
Thanks for asking. It's been huge. I've had to really think about some of our training education. One, are we getting feedback from communities who are affected? And how is that working? So how are we actually soliciting feedback? And two, I've had to think about, what does a family do? What does an individual do once a training's gone when they go back home? And what are the tools that we're giving them? Are we helping them, really manage once they're on their own? So I think I guess I'd say it's brought up a level of empathy that I'm not sure I had fully tapped into. They need skills, they need something, and making sure that we're really working with the communities to do that, and really making sure we're being empathic about how we're approaching that information, how we're talking about things. So I think I think I'm fortunate in that I do have this job at the Depression Center, and so I do have an ability to have some impact on not just other people's lives, but the programs that we're doing. So I spend a lot of my time now thinking about whenever we do anything, how would I as a parent receive this, or how would I with somebody lived experience, how would I receive this, and what would I be able to do with this information? So again, I think if I were to sum it up, I'd say that going back to the idea about bringing out empathy that I'm not sure I fully knew I had or I had fully tapped into, especially when looking at training and education programs. Well, thank you. I'm sure we could talk for a really long time.
I think so.
So I really appreciate you giving us this time, and I look forward, hopefully we get to do more work together and more of these, but for now, I really appreciate this, and thank you so much.
Yeah, thanks, Matt. It's been really wonderful hearing more about your experience and where you're taking that experience now.